Hi all, hope all are safe, good, and having a very good new year. So, today we are going to see how to maintain a good oral hygiene. First, the most important is whatever we eat, starting from the milk to the chocolates, cakes, or whatever the food we eat, anything, whatever we eat. First, we have to gargle the mouth immediately after the food we eat. So, it can actually prevent a lot of problems starting from cavities to other periodontal issues. Mainly, it prevents plaque formation. Second, it's not that we have to brush your teeth twice. Of course, it is good to brush your teeth twice, but at least once early morning when we wake up, at least once we brush your teeth in a proper technique. It is the best to maintain our oral hygiene. The best way to maintain this good oral hygiene by brushing is something called as modified pass technique. I will explain how to do that in upcoming videos, and for children it's phones method. Some foods have seen to cause more caries. Some foods have seen to reduce caries. For example, more caries causing foods like chocolates, cakes, other foods like milk dairy products that actually forms lactic acid in our mouth will always cause caries. But no matter, after we eat any of this, just we ensure that we gargle properly. There is no risk of any of this. Sodas, etc. are actually acidic products that can actually erode your teeth, and it can actually cause a damage to the enamel. This will cause increased caries probability, and that can actually reduce your oral hygiene. There are some drugs that can actually cause a problem to your gums. For example, they say it as a calcium channel blocker, or some drugs which is given during pregnancy. These drugs actually cause problems to your gums. You can actually visit a dentist every 6 months. If needed, do a scaling. If needed to do a filling, you can actually maintain this problem in a better way. Whatever the drugs, etc., whatever is it, the most aggravating factor is the plaque that is getting accumulated with regards to your gum diseases. So once we remove this plaque, gargling, as they say, thrice or 4 times, I am saying gargling, that is very much important. After that, 6 months once we do scaling if needed, because in some cases whatsoever we brush, there are some places which is actually inaccessible for your brush. In that cases, if you do scaling, it can actually improve your gum health. In overall, can improve your oral hygiene. Eat more of raw foods that can actually remove your all plaques and other problem dirt, etc. They have some light abrasive effect which is acceptable. For example, raw foods, raw vegetables that can do a wonder for your teeth. Visit your dentist once in 6 months. If needed, they will be suggesting you something called as floss or interdental brushes. This floss can actually go between your teeth, side to side. It can go between your teeth and clean it with paka cleaning. And interdental brushes, in cases it is going to be a pen like something, which a brush, a small brush like something that can actually access your gaps between your tooth and make a clean area for you. Mouthwashes. Just before going to bed, we can use a mouthwash. Go to a dentist. If they advise you use a chlorhexidine mouthwash, use it for 1 month. After that, you can actually change your mouthwash. There are Listerine and all other mouthwashes. In case it is not affordable for you, or you feel that something natural you want, just take a mild lukewarm water, add some salt in it, gargle. The best mouthwash I have seen ever. So these are the few things that we have to follow to have a good oral hygiene. I wish all a happy new year and a very good oral hygiene, so that you can have a healthy life, a salubrious life, since face is the index of mind. Of course, guys, oral cavity is the index of body's health. It is all connected, interrelated. Thank you, and I have a fantastic new year.